Good morning, everyone. Thank you for joining us. We'll give it just a moment or two and we will get started. Thank you. Good morning, everyone. Thank you so much for joining us. We will be getting started right now, and I'll turn the floor over to Alyssa.
Good morning and welcome. My name is Alyssa Chalodowski, and I'm the Chief Program and Policy Officer with United Way of Southwestern Pennsylvania. And welcome to The Question Before Us. I'm a white woman in my mid-50s. I have light brown hair and blue eyes. I'm wearing a purple top and jacket. I'm in my office at United Way in downtown Pittsburgh, and I use she, her pronouns. United Way is striving to be more inclusive in all events, which is why you will see that we are being joined by an American Sign Language interpreter. We also have activated live captioning through Zoom, and you can turn on live captioning by selecting the live transcript button on the bottom of your screen on the Q&A button. Now, to start our program. This is the 5th session of The Question Before Us, an initiative we started in 2020 to elevate the discussion of key challenges that face our region. This forum has brought together leaders and experts from across our region to discuss some difficult questions on topics such as the inequities of childcare and how to better care for the needs of aging adults. We invite you to view any of our previous sessions, and they are linked on our YouTube channel, which is in the chat button, and I would encourage you to subscribe as well. This forum started during the pandemic as a way for us to stay connected and continue to engage the community on important topics and that were timely. The convenience of meeting virtually has really helped us with attendance to reach more people more regularly and continue to keep these conversations going. United Way will continue to convene leaders and experts and engage the community on these issues vital to the lives of our neighbors and the future of our region. This series will continue to be open to everyone in our community, and we are very grateful for the support of the Eden Hall Foundation, which has helped to make this series a possibility. When it comes to tough questions, perhaps the hardest one is asked 1 million times a day across our country: what is there to eat? And the answer for far too many people is not nearly enough. In 2019, there were more than 207,000 people living with food insecurity in Allegheny, Armstrong, Butler, Fayette, and Westmoreland counties, according to data from Feeding America. And that was before the pandemic, before the upheaval in our supply chain, and before the sharpest increase in inflation in more than a generation. At United Way, we know that food insecurity does not exist as an isolated single issue for low-income families. A lack of access to dependable nutrition almost always overlaps with other factors such as affordable housing, acute health problems, and social isolation. Poor nutrition increases the risk of many health conditions such as diabetes and hypertension. Conditions like food insecurity disproportionately affect people of color. I have a question for our audience. When you hear the term food insecurity, what's the image that comes to mind? We often think of working families struggling to put food on the table, but although that's accurate, that's just part of the picture. Hunger affects our senior citizens, it impacts people with disabilities, and one segment of the population that we may not always think about being impacted is college students. And let me explain a little bit about that. A full 71% of students that are in college are non-traditional, meaning they are financially independent, they might be enrolled part-time, and they're often also holding down a job. Sometimes they may be caring for a parent or children of their own. And the math just doesn't add up when you have all of those things happening in your life, and they may struggle with food. Most students have to sometimes choose between staying in school and meeting basic needs like food. They may need to work more. So that's just one example of how food insecurity is intertwined with many issues that our neighbors are facing. To help better frame our discussion today, we're delighted to be joined by Lisa Scales of the Greater Pittsburgh Community Food Bank, where she's been president and CEO for 10 years. The Greater Pittsburgh Community Food Bank stretches across 11 counties in southwestern Pennsylvania and works with a network of 850 community partners to distribute food for nearly 45 million meals annually. Lisa received her Juris Doctorate degree from Boston University School of Law and her Bachelor of Arts from Seton Hill University. She serves on the board of directors of Adagio Health and is an advisory board member of the Center for Supply Chain Management at the University of Pittsburgh, the Centers for Community Engagement at Robert Morris, and University of Pittsburgh Johnson Institute for Responsible Leadership. In December of 2021, she received the Coleman Award for Excellence in Community Service from Pitt's Institute of Politics. And in February of this year, she was included in the Pittsburgh Business Times Power 100 list of most influential business leaders. I'm really excited to see Lisa and our great panel today, and I'd like to say welcome, Lisa Scales.
Well, thank you so much, Alyssa. I really appreciate that. I am Lisa Scales, and I'm a white woman in my early 60s with gray hair and glasses, wearing a blue shirt with some white flowers on it, and working from my office here in the city of Duquesne, and my preferred pronouns are she and her. So I want to start today. I'll share my screen here. I can, oops, now I can't seem to find my PowerPoint presentation. Okay. See if I can pull it up here. Sorry about that. Yes, can you all see the screen now?
Yes.
Thank you so much. All right, I'm going to start today by providing a little bit of background about food insecurity and what the difference is between food insecurity and hunger. Hunger is that physical sensation of when you have not eaten in a while, but food insecurity means you don't always know where your next meal is coming from. And so in terms of the USDA, they define it as a lack of consistent access to enough food for an active, healthy lifestyle. And as we know, when people call, say, when people call 211, they may be in need of food assistance, but they have other needs as well. And so there are multiple issues affecting people who are low income, and it could be housing, could be utilities are about to be shut off, transportation issue. So the folks who we're serving at food banks have a multitude of issues that they're dealing with, not just lack of food. And so, as Alyssa said, she talked about the college students. You know, many of our colleges and universities now have food pantries on site. But the most vulnerable people who we focus on at the food bank, and of course we want to ensure everyone has enough food to eat on a consistent basis, but the most vulnerable of our neighbors are our senior citizens who are on a fixed income, children, people with disabilities, veterans, and especially people living in rural communities where they lack transportation and aren't always able to get to a grocery store or even a food pantry at times. And not all people who are food insecure that we can say that they have the same experience. So there are different levels of food insecurity. There are people who come to a food pantry a couple times a year, and then there are folks who come to a food pantry on a monthly basis. And it all is about their resources or lack of resources that they have in their family. Some people come to us because they're in a seasonal position. They have a job that's seasonal, and there are times when they're out of work and they're in need of food assistance. Then there are folks who are very low, who are in abject poverty, who are generational poverty, and they need our support, or a senior citizen who's on a fixed income that's not going to change. And so they need to come to the food bank on a regular basis. And so what is that food experience like? And so when we think about the charitable food experience, and we take the pandemic as an example, that all of a sudden you are out of work, you don't have a job, you're not sure what to do. And so you're looking for opportunities to make changes in your lifestyle. So you may dip into your savings, you may rely on family. You're going to change your behavior at some point, and that could be skipping meals, doing different things to extend watering down milk so that you have more milk for cereal. There are things that you will do to adapt to your situation, to extend the food that you have in order to continue to eat on a regular basis. And then you might find out about a food pantry, whether that's on your own or through a friend or a neighbor or family member, and you will seek out support. You'll come into the pantry and you'll be assessed. And often many of our pantries are providing other services. They may be enrolling people in SNAP, formerly known as food stamps. They may be helping to connect people to other services as well. But it's so essential. People find themselves in line at food pantries that's really unexpected. And I think of a great example of a woman I talked to several months ago, Elaine at North Hills Community Outreach. And she was leading a typical middle-class life, was a writer and an editor, owned her own home. And then she fell down a flight of steps. And that changed everything for her. She could no longer work. She went to North Hills Community Outreach in terms of some housing assistance, but found out about their food pantry and is now able to get food from that pantry each month. And so there are a number of barriers and challenges that cause people to not go to a food pantry. And some of that is, frankly, the hours of operation. Food pantry may not be open when they're in need of it because they're working sometimes 2 or 3 jobs. They just don't know about food pantries or what their options are. They may have been rejected for some other benefits such as SNAP. And as a result of that, they believe that they're not also eligible for going to a food pantry. Then I want to talk a little bit about Feeding America, and that's the national network. Feeding America, we're one of 200 food banks that are a member of the Feeding America network. So no matter where you live in the country, you are being served by a Feeding America food bank. And you can see here on the map the location of all the food banks. You'll see some of the states that don't have a food bank in it, but I will tell you that they are being served. If you look at Wyoming, and Feeding America is about to launch a new food bank in Wyoming, but Colorado, the food bank in Colorado and food bank in Montana help to serve the state of Wyoming. And then when we look at what the trends are from Feeding America, from our national office, and our CEO, Claire Babineau-Fontenot, issued a challenge of us that by 2030, we would reduce food insecurity rate down to 5% and cut the disparities by race and place in half. That is a big, hairy, audacious goal because the food insecurity rates could be anywhere from 9% to 18% now. So that's a big challenge for us, but we're up to it as a network. And we know what we need to do is to continue to shift more power to the communities. And I'll talk a little bit more about that later. But we always put the community at the center of our work, especially our policy work. We're focusing more and more on providing culturally appropriate foods. And of course, the health, and I'll speak about health equity also. And then Feeding America, that's the state association. There are 9 Feeding America food banks that serve Pennsylvania. Most of us have a multiple county service area, but you can see here in Western Pennsylvania, there are 2 food banks that are 1 county food banks. The food bank in Delmont serves Westmoreland, and the food bank in Sharon serves Mercer County. And in terms of the impact that the food banks here in Pennsylvania have, that annually we do serve about 2 million people with just an incredible amount of food. And also we have a great, across the Commonwealth, a great number of volunteers who help us distribute the food. And then in terms of the food bank, here in Southwestern Pennsylvania, we serve 11 counties. Other than in Southwestern Pennsylvania, we don't serve Westmoreland County, but all the surrounding counties. And we do this through a network of 850 partners, as Alyssa said. And last year we distributed food for almost 45 million meals. And on average, we serve about 120,000 people each month. And half the people we serve are kids and seniors, some of our most vulnerable neighbors. You can see here on the left of the slide, the mission is to feed people in need and mobilize our community to eliminate hunger. And our vision is for a hunger-free Southwestern Pennsylvania. I will say we are making changes to our mission statement and our vision statement as part of our strategic planning process. And so we will be unveiling the new mission statement and vision statement in September. So stay tuned for that. And then where does the food come from? So many folks think of us from the old days of food banking, where almost all of the food was shelf-stable items, peanut butter, canned fruits, canned vegetables. We also would have a lot of snack food, candy, cookies, crackers. Well, that has changed dramatically, especially over the last 10 years. More and more of the food we distribute is fresh food, not as much as donated. So you'll see here now from last fiscal year that 42% of the food that we distribute is donated food. Back in 20 years ago, 25 years ago, that percentage of donated food was significantly higher. And most of that donated food is fresh produce. The second largest category is government commodities. The biggest way the federal government supports us is through the actual acquisition of nutritious food. And so we will receive fresh produce, frozen chicken, canned goods as well. And those government commodities are so essential to help us fill up our shelves here in the warehouse so that we can have that good nutritious food to offer to our network partners. And then we do purchase items that are not typically donated. So we have a purchased inventory list that our agencies would then purchase from us. And of course, then everything is distributed and delivered to families at no cost. And so the food originates, from the local level to the national. Really happy to say we have a number of retail stores that donate to us. About 40 area farms provide fresh produce to us during the growing season, caterers, restaurants, and produce wholesalers. And then regionally, there are different distribution centers that will have product available to us. And then again, nationally, the government commodities. Feeding America has a donation website where we can go on and identify items that we would want to select to bring to our food bank. And then, of course, produce brokers. And we do, through donations, able to acquire from produce brokers that fresh produce. And you can see here, in terms of fresh produce, that last year was 32% of our distribution was fresh produce. Our goal, and we had established a bold goal back in 2015, looking out over 10 years. So by 2025, our goal is to acquire and distribute fresh produce in greater quantities. And we've even changed our distribution methods in order to do that. And our goal is that 50% of the food that we have will be fresh produce. So we're well on our way to that goal. And why it's so important, you'll see here what may be some shocking statistics, or maybe not, in terms of people's health and wellness. So when we survey folks and we ask them about health issues that they're experiencing, you'll see 42% of the households we serve have someone who has diabetes. 68% have someone with high blood pressure, and 62% of the people we surveyed said that they had to choose between paying for food and paying for medicine or medical care. And a number of years ago, in a survey, 72% of the people we surveyed said they chose less nutritious, unhealthy food because that's all that they could afford. So I do want to talk some about our neighbor experience. Who is it who we're serving? And if I go back to the founding of the food bank and when we were incorporated in 1980, we came into an existence at a time when there was high unemployment due to the collapse of the steel industry. And so at that time, most of the people we served were unemployed. There was also at that time a growing homeless population. And so many of the people we served were available during the day. And so our pantry network that organically sprouted up was often open a few hours once a month during the weekday. And most of the food, as you can imagine, were those shelf-stable items such as pasta, soup, peanut butter, and snacks, as I spoke to earlier. But if you fast forward now and we look at food insecurity most recently, you can see what those rates are, and they vary county by county. And we're charged with the equitable distribution of food in each county in our service area. So we look at how we operate in Allegheny County, that may be different than how we operate in Somerset, and the rates of food insecurity are different. And when we talk about equity and the equitable distribution of food, we're also looking at people who are disproportionately impacted by food insecurity. And we're really focusing on race and place. And so in terms of race, there are 4 counties in our service area where the difference between the poverty rate for people of color and white residents is more than 20%. And those counties are Allegheny, Beaver, Cambria, and Lawrence. And so we see those disparities by race, and we are working to address that. And then what's possible? What can we do as a food bank? And food banking is in a period of transformation. We've really changed how we operate from that warehouse that distributes mostly shelf-stable food to people who are typically unemployed. They could go to a food pantry that may be open 2 hours, on the 3rd Thursday of the month from 10 to noon, and that's the core of what we do. And we still provide a significant amount of food to our neighbors, but we're also enrolling them in SNAP benefits along with other partners here in Allegheny County and in southwestern Pennsylvania. We're connecting people along with United Way to other services. And we're also working more closely with people so that we can be more responsive to how we're providing services and really truly listening to the needs of our neighbors so that we're sure that we are meeting their needs. And when we think about the continuum of meeting people's immediate food needs on one end of the continuum, we look at the other end of the continuum, which is really truly ending hunger. And what can we do as a food bank to assist in that? There are many factors outside of our control, especially the economy, as we know now with inflation. but we can be a connector. We can work with our partners and connect people to those services and opportunities, whether it's jobs or job training opportunities, whether it's transportation opportunities. We have a nice partnership with Heritage Community Initiative in Braddock to provide free rides. There's many opportunities that we can play as a food bank to really look holistically at the needs that people have. And so we're in the process of transforming the food bank system. We want to do more to meet those immediate needs, but also address the root causes. We know, and we've learned from the pandemic, that we can be more agile and responsive and build up and scale up new programs that were started within days, and then scaling those up. And our mantra has been for about 10 years now, we need to get food closer to where people are when they need it. So doing much, much more to get food closer to people where they already are going. We want to have food there. And I'll say during the pandemic, we added 150 partners, and they were providing other critical services like the Latino Community Center or Veterans Leadership Program, Casa San Jose. People were already going there. Those organizations called us and said, you know, the people we're serving, they're in need of food. So we have food that we're getting to them. And that's so critical for us. You know, we're not your mama's food bank anymore, and we haven't been for quite a while in terms of the quality, the fresh food, nutritious food, and getting food out to people in new and different ways. And we truly believe that food has the power to transform lives, and that does inspire us every day. And we continue to put the voices of people we serve at the center of our work. We're doing more to lift the voices of our neighbors. We have a new pilot in 3 of our rural counties to co-create programming in those counties. And we believe that will allow us to address some of the disparities we see in rural counties. So thank you very much. I appreciate you being here today on this call. So happy. Thank you, United Way, for addressing this critically important topic. Thank you so much. And with that, it's my pleasure to just unshare. All right, thank you so much again. And now it's my pleasure to introduce the moderator for our program today. It's Brooks Broadhurst. And Brooks, I know well, I've known for many years. So pleased that he's moderating today. He's a restaurateur, an entrepreneur, philanthropist, and a member of United Way's board of directors. After more than 20 years at Eaton Park Hospitality Group, where he served as a senior vice president, Brooks went on to start other ventures as well and develop and manage United Way's Student and Families Food Relief Fund, which was instrumental in providing millions of meals to families with students when schools shut down during the pandemic. Brooks has spent his life bringing people to the table, and he certainly helped put an all-star panel together for you today. Hello, Brooks.
Hello, Lisa, and thank you. I love the end of your conversation with the line, the food has the power to transform lives. You know, I think that that is such a critical component of everything we're going to talk about today, because it does truly impact everybody, especially, you know, younger kids that we've done work with in the past, the ability for them to have something to eat before they go to school and the impact that has on their future lives. So, and Lisa, I do want to thank you for great work you do at the Greater Pittsburgh Food Bank. For more than 10 years, you've led the food bank through probably the greatest crisis in our generation. And I've enjoyed our various times working together, and thank you from everyone here in Southwestern Pennsylvania. So again, I'm Brooks Broadhurst. I am tall, slightly overweight, white male with seemingly ever graying hair, sitting in my home office wearing a blue and green button-down shirt. My pronouns are he and him. In a country so prosperous and agriculturally diverse as ours, it should go without saying there's no excuse for our residents to go hungry. And how can we better innovate in order to address the nutritional gap, especially here in Southwestern Pennsylvania? Well, that's the question we're going to put to our guest panelists today. And as Lisa said, we've got an all-star panel I'm very excited about, especially since many of them I consider good friends. So let me introduce them. First is Leah Lizarrando. Leah is the CEO and founder of Food Rescue Hero and co-founder of 412 Food Rescue. The Food Rescue Hero platform technology is used by food recovery nonprofits in cities across the United States and Canada to recover food that would otherwise go to waste and make sure that it goes to people that need it most. Leah has won numerous awards for her work, including the CMU Carnegie Mellon University Distinguished Alumni Award, and was recently honored with a Global Leadership Award from Vital Voices. She has been featured on NPR, Fast Company, Washington Post, U.S. News and World Report, and I can go on and on and on. In 2020, the Food Rescue Hero technology platform won Fast Company's World Changing Ideas Award and was named a CES Innovation honoree. Leah is a Rockefeller Foundation Acumen Fellow and received her graduate degree in public policy and technology from Carnegie Mellon. Welcome, Leah. Our second panelist is Dr. Sandra Curry. Dr. Curry is the Executive Director of Community Partnerships with the United Way serving Butler County. She oversees development of agency programming in the areas of agricultural development and food security. She received her doctorate of strategic leadership with a concentration in entrepreneurial leadership from Regent University and has had a 14-year career in the nonprofit sector. Thank you, Dr. Curry, for joining us. I believe she's in her car today, so we've encouraged her to not have her camera on as she's traveling.
She's actually stopped, so she's good.
Okay, good, wonderful. All right. We are lastly, but certainly not least, my good friend, Chef Claude Pierre. Chef Claude grew up in a Haitian American household in Brooklyn, where he discovered his lifelong love of food from his grandmother. Here in Pittsburgh, he founded the EAT Initiative, which stands for Empowerment, Awareness, and Training. It's a nonprofit dedicated to empowering food insecure communities throughout the Pittsburgh region to source, procure, and prepare their own healthy food. During the pandemic, Chef Claude launched the Third Meal Project, which is a weekly meal delivery program that provides dinners, groceries, and snacks to families and seniors in need. He has better hair than I have also. Welcome, Chef Claude. And before we dig in, let me remind our audience that they all have a seat at the table. If you have a question or comment to add on the topic of food insecurity region, please add it to the chat. Okay, so welcome everybody, and why don't we get right into it? So you can start this off, Claude, since if those of you don't know Claude, he's usually pretty willing to jump in at any time. So, but we all want to answer this. So what specific food insecurity issues do you see in our service region, and especially where your agency serves?
Good morning, everybody. I'm Chef Claude Pierre. I am a Black male. I have long locks. I am a little overweight, but I like to think my shoulders are pretty strong. I am happy to be here. I go by he, him. Thank you for having me. When we talk about food insecurity, right before I jump in, I love to talk about when you say food justice, we talk about food injustice. So kind of like we always look at it as if we need to answer the solution to the problem when it comes to food injustice. What is happening? And that's where the EAT Initiative, Empowerment, Awareness, and Training Initiative, we started saying, hey, there's so many siloed efforts. We wanted to start to create meals and just provide access to fresh produce and food, but breaking silos, just connecting dots between various organizations that we already work with, including the United Way, including the food bank, including the YMCAs. So to answer your question, Brooks, part of what we do is bring people together first, like organizationally, and then also just tapping in saying, hey, what do you need? What do you have? We work closely with the city of Pittsburgh and also the Food Policy Council to kind of like form a food access network. So that's where I think, the beginning phases start, but always asking that question, what is food injustice? What's happening around? And once we start with that, it starts to, pop innovation.
Great, thanks, Claude. Leah, any thoughts on specific issues that you see currently in our region?
Yes, I am Leah Lizarrando. I am a Southeast Asian woman with Black hair, dark skin, and I'm wearing black today, and my pronouns are she, her. Thank you, Brooks. So for it's the same issues that Lisa and Claudia have mentioned. And another issue that 412 Food Rescue is focused on is actually reach. So when we do our work, because of the way 412 Food Rescue works, where we mobilize drivers to deliver food, both surplus and donated, one of the things that we can do is that we can go to places where it is difficult to put up warehouses or pantries or any other thing that might be a barrier to creating an access site. So what we're able to do is quite simply what many of us in this call have done during the pandemic and continue to do, is that have our food delivered directly to our doorsteps. So we work essentially like DoorDash, and one of the things that we found valuable about this model is that we are not limited in terms of where we can go. And by doing that, and I'm going to put a link in the chat that everyone can access, is we've identified areas where there are barely any food access service for populations that are experiencing food insecurity. And what we've done is we've focused on those areas and ensure that people have food access within a 15-minute walk.
That's great. Thanks so much, Leah. Dr. Curry, you're obviously up north in the Butler area. Anything different that you see and hear up there than what is occurring down here in in Pittsburgh area?
So good morning, everybody. My name is Sandra Curry. I am the Executive Director of Community Partnership, which is the community action agency in Butler County. I am a mid-40s white woman with long dark hair. I am in my car because I have a meeting at 9:30, and I live in my car. I am wearing a blue and coral dress this morning, and my pronouns are she and her. I think we are seeing transportation is a huge factor for our clients. Not all parts of Butler County have access to a grocery store within 15 minutes. In fact, a lot of people are driving, 30 minutes to get access to food. So if you don't have transportation or you don't have a vehicle, it can be very hard to access the food that you need. I think inflation is affecting folks up here. I know the community meal networks that we support, their numbers have gone up dramatically in the last several months. So I think that's also something that is very important. And even though we are a very prosperous county, we also have some pretty significant food deserts. Again, we're a large county, we're very rural. We don't have full service grocery stores in all of our communities. And so a lot of folks can't physically get to where they need to be. So I think those are some of the big things that we're seeing right now in our county.
Great. Thanks so much. Sticking with what you mentioned about inflation, Lisa, obviously government funding and donations and things are a very big part of, as you mentioned. What impact have you seen as inflation having on the ability of you to bringing in enough food for your constituents?
A great question, Brooks, and it's certainly impacting the people we serve. We have seen a dramatic increase in numbers of people calling us, coming to the food bank, going to our food pantries in the last month. We have a small on-site food pantry. We're about to open a much larger pantry here on site this summer, but just the other day we had 60 people show up unannounced at our food at our warehouse here in Duquesne for food. So it's certainly impacting them, especially the cost of groceries and gasoline. And for the food bank, it's significant. We think about it in terms of freight, in terms of packaging, in terms of all of our supply costs. So we get a lot of our purchases are quoted at a delivered cost. So sometimes freight is mixed in with the cost, but we're 34% over budget on our freight line this fiscal year because of the increase in transportation costs. And and the price of diesel fuel has doubled since 2020. And we have on any given day, 7 to 9 diesel trucks out on the road. And then in terms of packaging, over the past 18 months, due to the increased cost of metals, cost of empty cans has increased. That's been a driver in the cost of canned goods being higher. And paper shortages. So again, with our boxes, we have corrugated cardboard, and all of those costs have gone up as well. And when we look just in the month of March, we spent $1 million on purchasing needed food items. And then we're also looking at the impacts of the war in Ukraine. And as we know, Russia is a big exporter of fertilizer. And so we've heard from local growers that they're concerned about the cost of fertilizer. They may end up planting less. And of course, then Ukraine being a large exporter of grain across the world, that's impacting the costs of cereal and bread and other items. So we're doing what we can. Our average cost per pound of purchased food was 68 cents. And in 2021, that increased to 78 cents. And now it's more than $1.
Wow, that's massive impact for sure. Thanks for that information. So on to our next question. I want to piggyback a little bit off what Dr. Curry had mentioned. Leah, she talked about transportation being an issue, and obviously from an innovation standpoint, that's almost everything that you have kind of worked on. And so walk through briefly, how your technology has started and then how it's evolved over the last number of years with everything that's happened in the world.
Yes. So our technology started to solve a specific problem in food supply, and that is surplus food. So if one of the things that we learned in early 2010s was that, we waste up to 40% of our food supply. So if you can imagine, on the other side of that, we know, as Lisa demonstrated, that there are so many experiencing food insecurity. So that is, not only a logistical disconnect, we see it as a moral disconnect. So what we do is we solve that disconnect, and we work with, thousands of retailers, food retailers such as Giant Eagle, and even distributors such as US Foods, and restaurants such as Parkhurst and Eaton Park. And we take what's surplus every day and we redirect it to nonprofits, and sometimes directly to the households of populations who are experiencing food insecurity. And the way we do that is we have, the easiest way to explain it is a DoorDash model. So our volunteer drivers download the 412 Food Rescue app, and they get to see where the food is available and where the nonprofit or household that it has been matched to. And just like any driver for Uber Eats or DoorDash, they take a food rescue that is convenient for them whenever they have time. So in doing this, one of the things that we found out was that, we often see food insecurity as, a standalone, so to speak, issue. But we know that there are many, many comorbid factors to food security, one of them being transportation. So a lot of people who are experiencing poverty and food insecurity also don't have access to adequate transportation. As Dr. Curry pointed out, many, especially outside of Allegheny County, would need about 30 minutes away from any food supply. And so when we think of that, there's transportation problems, and, there's time issues. People don't have time. Even if they have the ability to access food, they often need to ride 2 buses or, make sure that between their 2 jobs, they're able to go to a food access point at a time that it is open. And so we solve for these barriers in the same way that ourselves, require convenience to, get food. I know I have my groceries delivered, and that way it can work around my schedule. So those are the other barriers that we solve for. It is, we see convenience as a right, and our volunteers are there to ensure that, the folks that we are serving have this as one of the things that, enable access.
Great. Thanks, Leah. And Claudia, on a similar thing, track, talk a little bit about the innovative ways your group and program and EAT initiative has transformed over the last number of years. Obviously, from what you were doing before with the pandemic hitting and all the work you did around COVID to what you've become today?
Man, I just want to say, first and foremost, I am so thankful for Leah and 412 Food Rescue. You guys have helped us in so many different ways. Likewise with the food bank. So the crazy part about innovation for us is, I could talk about tech in a second, but what we're doing is the grassroots side of it, right? We have been already connected to so many churches and the YMCAs and the libraries where people where people are already coming. So our whole model is meeting people where they are, right? That's the key. So with a program like what the food bank has, and sometimes you have to get there or you have to get it delivered, utilizing, technology like Leah has with 412 Food Rescue, but really is understanding where the people of the community are. As you know, I live in the Hill District, and it's a tale of two districts, right? Working downtown and close into the city, we're not even going to talk about rural because obviously in further areas, there's even more transportation and a lot of different difficulties. But right here in the Hill District, which is less than a mile from the cultural district, right? You literally don't have, it's a tale of two districts. You don't have access to fresh produce or food. So leveraging technology like the food heroes, leveraging technology like understanding like we are drop-off point for the food bank. They literally bring us food here on Bedford Avenue in the Lower Hill District, across from PPG Paints Arena. We are able to literally tell the people of the neighborhood, hey, we don't have a grocery store in the Hill District. And yes, you do have to take 2 buses to get to your nearest Giant Eagle. But what we're doing is saying, hey, you could come right here, or leveraging 412 Food Rescue. Hey, we have a group of families or people, and literally using the technology that already exists. And as you can see, I put something in there called Food Secure City. Food Secure City is a presentation. It's an idea. We believe that Pittsburgh, with the philanthropy, with the educational system, with all the tech and all the companies that already exist. We're not trying to recreate the wheel. If we actually come together and talk like this, Brooke, so thank you so much for the United Way and everyone bringing us together, we can become the first food secure city. That is actually a reality, right? Where you're standing in Hazelwood and we can use 412 Food Rescue to get food to you. We can use, the food bank to have a drop-off point. We can also use companies like UMI, which is a upward mobility initiative, or the Food Policy Council, which has a listserv, and even the city, 311, 211, to say, hey, it's not about the EAT initiative. It's really about the people. And so I love the fact that we're talking about technology, but really, if you go back up to that presentation, you'll see how we're saying policy, and we're talking about programs that already exist and actually bridging those gaps, right? And so I think that's where my innovation starts to go, and we start to say, hey, let's utilize 412 Food Rescue, uplift it. Let's utilize the technology and the different drop-off points for the food bank, but literally create a hub so Pittsburgh can become that first food secure city. And then it's a messaging campaign. We're talking about a whole educational campaign about what food justice is, what food insecurity, food security is, because I want to asset frame. Like I said, I live in the Hill District. What we don't want to do is keep saying how horrible it is and how ugly it is, right? We want to start talking about how the Hill District is a very important space in the city of Pittsburgh, and people have no access to fresh produce and food. When my students are telling me they go to the dollar store to buy dinner, that is a problem. You understand? So I'm saying that to say, let's leverage all of the pieces that are already here. And the city behind me, I love it. With the new administration, with new technology that's emerging, why wouldn't we not start to come together and create a food secure city? So I think that that's where my thought process starts to go, but incorporating Food Policy Council, incorporating the city, incorporating tech from 412 Food Rescue, incorporating all the benefits and the things that the food bank has. And I think we're on to something special right now. And I'm gonna be honest with you, if we don't do it, we're killing our own people. And we got to be serious. We got to start to really shake things up. You know what I mean? So that's my point of view when it comes to how do we leverage the technology and how do we really start to pull together to make something special happen.
That's great, Claudia. What I do wish, though, is that you had a little more passion. It doesn't come through very well on the Zoom calls. But I think everything you said is wonderful. And I think that, we have good people around the table good people listening in right now. So hopefully we can really, with leadership like from you, how can we get some of these things mobilized and motivated? So, but I do want to go to Dr. Curry. One of the things that was mentioned with Lisa's conversation was nutritional importance, and how important the idea of not just, and Claudia, you just touched on it with the idea of going to the dollar store to buy something, because obviously that's the least expensive thing to do. So, Dr. Curry, up in Butler County, why is it important to have access to fresh foods versus simply just non-perishable, inexpensive? And in some of the areas you talked about where they're far away from grocery stores, how are you able in that area to source those food for those people, and then distribution of that? It sounds like it could be a challenge.
Right. So I think one thing that we see here with our communities, fresh food directly impacts physical health. And I think that's really important to keep that in mind. Our hospital system just did their needs assessment. And many of the diseases that are prevalent here in our county are directly related to diet. So that is really, really important to keep in mind. So, some things that are happening in Butler, our hospital system, for example, has a fresh food institute that they've started, which is modeled after the one that's happening in Allegheny General, actually. Some things that we ourselves are doing, I think it's important to think about food from the production end and where it starts. We are actually on a small scale and potentially exploring on a larger scale what it looks like for us to produce our own food. So we started to grow some things on a small scale last year. We provide a free CSA box every summer. We started that last year. We're going to continue that this year, and we get some things donated from that, but most of that we grow ourselves. So we're trying to experiment with cutting that supply chain to cut our costs, but also to cut transportation. Because a lot of people don't know that most of your food in our region comes from 1,500 miles away. So that contributes a lot to cost. If we can produce a lot more of our food locally, that'll help us be a more food secure region. Some of the other things that we are doing, so we partner with Emergency Food. We partner with Pittsburgh Food Bank to do emergency food distributions. Those happen every month. We've been doing that here in Butler since April of 2020. And those are going to continue, and we're going to be adding back a walk-up distribution next month. So we do a drive-up distribution and a walk-up. We also have a single county food bank here in Butler. So there are actually 3 single county food banks in Western Pennsylvania. We will take over management of that on Friday. So we will be supporting 32 existing pantries in Butler County. We share most of those pantries with Pittsburgh Food Bank, but we have been really working hard on taking more fresh produce in from the federal and state food programs that are available. And then something else that we're doing, which is pretty interesting, is we are actually working on putting together an educational platform to support farmers and growers. Because not only should we be growing ourselves, but our agricultural community is aging, and the average age of farmers is in their mid 50s. So, we're kind of facing an inflection point in production in our region. So we will be bringing on an education program for growers over the next 3 years. So we're pretty excited about that. So we're trying to look at food from a holistic standpoint, from the production end all the way to the distribution end. Our CSA boxes, by the way, are directly delivered to people's homes. So there's no transportation barrier for them to come and pick those things up. So.
That's great, Dr. Curry. Lisa, you mentioned fresh food in your discussion. And I know, being involved in the food bank for many years, the model has certainly changed, and you mentioned it, from the idea of, old dented cans that you were able to pull out of Giant Eagle and some of the grocery stores that they were very generously donated, that they weren't able to sell on the shelves, to now completely changing the way that you handle food. Can you just walk through again very briefly the impact that fresh food has had, not only on your business, but also in the community?
Yes, I mean, it's been so important. We've been on this journey for many years. So I started at the food bank in the mid-90s, actually working on our urban agriculture program. So the intent way back in 1996, when I started, was to transform our food supply. And again, we had a lot of cookies, crackers, snacks. We'd get canned vegetables, canned fruits, but we really wanted to grow our produce and reach out to our farmers. As Dr. Curry said, farming and it's year-round work to farm and not easy work. And so we had a gleaning program. We continue to have that gleaning program where we receive donations, but we're also supporting our local growers. We know how important that is, as Dr. Curry said. And so we'll contract with local growers to grow food, especially items like broccoli that may not be donated as much as some other items such as zucchini or tomatoes or corn. And so we'll work closely with our farming community here. And that's how I started at the food bank. We also operated at that time a farm stand project before there was even the term food deserts. I would go out and say, we want to ensure people have access to fresh, affordable produce in communities without grocery stores and farmers markets. So we didn't even have that term, but we at the food bank knew that there were food deserts and people did not always have access to fresh food. So our emphasis has really been on that, but it's been on the health and wellness of the people we serve. We hired a registered dietitian in 1991, the first food bank in the country to focus on nutritious food, because really food banks were known to, whatever we got, if it was candy, if it was snack food, we would bring it in and we distribute it. We have a health and wellness policy. We no longer take items, except donations by the pallet of items that the first ingredient is sugar, right? Many people we serve have money in their pocket. They have SNAP benefits. They're able to purchase items. So we see our role as a public health organization that we want to provide the most nutritious food. Our staff designed a rating system, a nutritional rating system. So when our agencies order from us and they order online, they can see, a 1, 2, 3. 1 is choose most often, 3 is choose sparingly. And other food banks around the country adopted that system. So the nutritional quality is important because of the health and wellness of people we're serving. But it's been tremendous. And to say our goal is 50% or 20 million pounds a year will be fresh produce, that really drives us here at the food bank. We want to provide the most nutritious food.
That's great. Now, Leah, your whole organization, I think, has been really focused on this idea of fresh food, because obviously you're not picking up tractor trailers worth of food. You're really handling small, independent, in between those gaps that maybe had existed there for many years. How important and how much of what you handle is what you folks consider fresh food, nutritional, healthy food?
Yes. So the nature of surplus food and the reason why it goes to waste is that it is nearing the end of its life. It is completely viable. And when I say nearing the end of its life, it's typically most warehouses can't take food that's 1 week away from being considered unusable. And we take food up to the day. And so because we can deliver it directly, we don't own any warehouses at all. So about 87% of what we recover is fresh food. And about 60% of that, 50 to 60% of that is fruits and vegetables. So the very nature of surplus means that it is fresh and it is the produce that we all need in our diets. So because our drivers, again, directly transfer, there's no limitation in terms of how fast we can get food, this fresh food, in the hands of those who need it.
That's great. And Claudia, I know everything you do is around fresh food and good, healthy, especially as a chef and preparing that. But I do want to move on to a slightly different topic, but which you have touched on quite eloquently earlier is food insecurity and what you, as you say, food injustice. What do you think would surprise people about the audience of your populations, and how is food insecurity an equity issue?
So the beautiful thing about what we're discussing right now is the fact that we have the I don't know, the privilege of coming on Zoom at 8 a.m. and literally talking about it. A lot of the people that I serve are literally racing to catch multiple buses to put the kids at daycare or camp or wherever they're going, and didn't get a chance to eat, didn't get a chance. So when we say food desert, a desert implies, sand or dry, or, it's not. Apartheid means that from almost a political standpoint, this is something that is, let's just say food apartheid would infer or would suggest that this is by design. There are neighborhoods that I serve that by design have been blighted, have been redlined. And so when we talk about the opportunity for all of us to come together and discuss how to grow and how to come together, I am representing the people. I am, like I said earlier, a Black male who lives in the Hill District, inner city, who literally see all these children. So I'm talking to the small businesses. I'm talking to the restaurants. I'm talking to also the urban agriculture people. I'm talking to the churches and the people that are literally constantly saying, hey, Chef, there's no way that the Hill District doesn't have a grocery store still to this day. There's absolutely no way. And I got to go to the South Side or the North Side or any other side but the Hill. There's no way that, I mean, I hate to say this, there's been distributions with some of our partners and they have very low, people that come out, turnout, because they're just so disconnected to the community. And that's where I think the EAT initiative really can thrive, is to help, like I said, the food bank connect to the community, help Leia and 412 Food Rescue have a drop-off point or pickup point, or really connect once again, because all of us are doing the work. Like, there's no shortage of people doing work around this. There is a shortage of people connecting on a very high level and really understanding the community that we serve, and just knowing like, hey, they don't have a car. They're not in a Jetta or a Subaru. They are on their feet. They're catching multiple buses. And then, like, I love the fact that, like I said, I mentioned UMI before, they have like a UMI score where we're collecting data too, right? When you have relationship with people, you can collect data, which literally helps us with the, social determinants of health, understanding, like someone said earlier about nutrition and pre-diabetes or pre-hypertension, understanding what that means. Lastly, I'm going to say, it's important for people to understand, like, I love when some of the heroes came and they encountered some of the people that they were serving. And the pandemic, it was a tale of two pandemics. Some people were really disconnected. And I met so many people from the Upper St. Clairs and the, North Sides that joined in and volunteered with nothing. It was just beautiful. They were delivering, they were picking up, they were volunteering. That's what I believe, is important for us to really see. There is actually a connectivity that we can do. And last but not least, the insecurities that we have, we can actually make them secure if we work with our city, our lawmakers, we work with local businesses. We got to stop thinking that we have the answer for the community, allow the community to work with us to create a solution for them, and then leveraging the Food Policy Council and the city of Pittsburgh and the local communities. These are the things that I kid you not, is my passion. And I think that everything we're saying is on point, but that's where, when you talk about food apartheid or food deserts or, injustice, that's what we have to look at. There is an actual injustice. By design, there's development, there's all types of things happening, and it hurts certain communities,
Great. Thank you, Claudia. As always, that's great. Dr. Curry, how do you see, or what do you think that our folks would be surprised about the audience or population that you folks serve up in Butler County?
So I think it's important for folks to remember that it's not only people that we traditionally think of as low income who are food insecure. I think that's something that that is key. A lot of the food assistance programs that are out there have income limits. And so, SNAP has income limits. Our state and federal food programs have income limits. But, what United Way looks at that Alice population, which is, that group of folks who are living right above those assistance programs, but who are still struggling. So I think it's really, really important for folks to keep that in mind. There are a lot of people struggling right now. We've talked about gas prices, we've talked about transportation, we've talked about inflation. I think there are people struggling right now who maybe, a year or two ago were not struggling, and they may not be eligible to participate in a lot of the food programs that are currently out there, but yet they are still trying to figure out how to feed their families. So I think that's, to me, when I think about what we're dealing with right now, and I think, honestly, I think that's only going to increase. I know I am probably not considered to be struggling, but my grocery budget pains me sometimes now when I go to the grocery store. So, food security just doesn't sit in one socioeconomic demographic. And I think that's really important to keep that in mind.
Thanks so much. And on to you, Leah, combining a little bit of what we were talking about with food injustice in the audience. Claudia talked about, I think you mentioned kind of connecting shortage, right? How do you connect people? And oftentimes there's a shortage of people that are available for that. Do you see that as a potential obstacle in the future to your model, the ability of having enough people to be engaged, getting food from point A to point B, and then, combining that with this idea of food equity and connecting people, if that question makes sense?
Yeah. So first, I want to kind of dovetail off of something Dr. Curry said that is really, really important. So for us, the way we work with partners such as the EAT Initiative, the Energy Innovation Center, is that we not only partner with traditional access points, we partner with organizations that are already serving people who may be experiencing food insecurity and poverty, not necessarily, providing food at the outset, but doing some sort of service. So we call these non-traditional food access points. And what that does is that it's, one of our goals is to remove some of these qualification barriers. One of the things that really that pains me to watch is the sheer requirement for documentation, right? In terms of what is required to get food support. And I think one of the things is that, because we do deal with surplus food, which is, free, we don't have any government support. So we don't have a lot of these requirements that are sometimes, very much a barrier to people. And so, and I think what, to your earlier question, Brooks, is that what a lot of people don't understand is that the risk of someone not needing food to try and access food is actually almost negative. Because if you have experienced, or tried to experience food access, the dignity and the loss of dignity in trying to do that is so large, that, it takes a lot for someone to actually try and do something that's, not necessary for them. So that's one of the things we value with our work, is that we have no barriers to access the food that we recover. In terms of connecting, there's a couple of ways I would answer that. The first is that because we work with community agencies that already exist, we don't, we know that they are connected, just like the EAT Initiative is, and all the other agencies that we distribute food to. And even our home delivery program, we're not a direct service. So what we do is that we work with the Islamic Center, and we ask them, do you have individuals that you typically serve that now cannot get to you? Can we get to them? And we have seen this accelerate so much in the pandemic, where many folks, with transportation decimated, with the requirement to be isolated, right? They have no other option but to have food directly delivered to their door. And so, one of the things that we worried about in the pandemic, yes, are we going to lose people who volunteer to drive? But what was really gratifying and really inspiring to see was that March 2020 was, the highest rate of downloads that we've ever experienced in our app. So in crisis, people want to help and are desperately looking for ways to help their neighbors. So today in Pittsburgh, we have about 15,000 people receiving push notifications on their phone saying there's food available here, can you take it here? And it's really all about making sure that the community knows that this is available to them, because people want to help, they just don't know how. And often, you know, it's barriers such as, you know, it takes 4 hours or 2 hours of your day can, you know, prevent people from actually doing something that they want. And so, you know, a food rescue is about 30 minutes and you can pick it on Monday, you can pick it on Sunday. So hopefully by being a convenient way to serve your neighbors, you know, we will keep on having thousands of people wanting to do this work.
Thanks so much, Leah. And I find your comment and everyone's comment around kind of loss of dignity with the idea of, you know, trying to access food is such an intriguing issue. And a little bit on that, and to you, Lisa, you know, what do you anticipate as future obstacles in addressing food insecurity? And is this idea of dignity, does it get in the way at times of people and their ability to ask for help?
Yeah, that's a great question, Brooks. And, you know, we talk a lot about dignity and respect and reducing stigma. Stigma, as all the panelists know, it's such a huge barrier to people having the courage to ask for help and to, especially in terms of food assistance. And when I think about the work, food assistance by its very nature is so transactional, right? You come, you get a box, you know, you get food, you take it home. But really for us at the food bank, more and more of our focus isn't about what we do, it's how we do it. And working with our network of 850 partners, it really is how we do the work. Because if you come to a food pantry or you go to a place that's serving a meal and you don't feel seen or heard, there aren't people there who speak your language or look like you, it's not a good experience. We want people to come back. We want them to tell their neighbors, their family, their friends that this is a place that you can go to for food and it's normalized. And so, you know, and I think about poverty, and poverty by its very nature is exclusionary, right? So we talk about inclusion and how important inclusion is. And it's so important because when you're living in poverty, you're excluded from so much in life, right? And so the more we can do to work closely with the community, again, and as all the panelists said, putting people at the center of our work, lifting the voices of people, not coming in and saying, oh, we know the solution, we're going to do this. As Chef Claudia said, you know, work closely with people in the community. They, you know, people know they have solutions. You know, we come in and listen and work closely with folks. And that's so incredibly important for us.
That's great. And we're going to get to our last question here. So if anyone has any other questions, please put them in the chat. We will try to get to as many as we can. But I'm going to go to Dr. Curry on this, and we're going to have the same question for everyone. What can companies, organizations, or individuals do, either in the community, in government, or even on this call, to help not only you and your organization address food insecurity, but just generally address food insecurity throughout the region?
So I think, you know, looking at ourselves, you know, having access to both funding and physically having access to food that is flexible, and that it's not tied to a specific state or federal program, I think is really important, especially for us, as we're looking at people coming in, you know, who fall outside of the traditional programs that are out there and the income limits that exist. I think partnering with the folks, you know, all of us on this call are already engaged in doing this work. So I think reaching out to folks who are already working on the ground in the communities is really important. You know, I don't think, you know, a lot of times you don't have to reinvent the wheel. I know we had a board meeting 2 months ago, and when we listed everything that we were doing in the food space, We had 12 different programs up on our board, our whiteboard, and we didn't even realize, really that we were doing that much. So I think doing research about who's doing work in communities that you're interested in, and really sort of digging in and working with those organizations to identify what can be done, and what the needs are, and how those needs can be supported is really important.
Great, thanks, Dr. Curry. Leah, besides just the idea of downloading your app and getting engaged as a food rescue hero, what do you see as ways that companies or organizations can get involved and address food insecurity?
Well, there's a lot of different ways. So, just looking at what the stuff that Chef Claudia Pierre is doing right now, which is fairly revolutionary and much needed. I think one of the things that, the first is kind of echoing Chef Claudia's call to action. We do have so many agencies and organizations that are working in food security. I think the biggest call to action is asking ourselves the question of how can we truly, truly all work together? How can we understand that the work that we all do are not exclusive, right? That it is, there is power in collaboration, that there's really no territory in this. And I think that, if we look at that as a true opportunity, if we give ourselves that challenge, can we become the first food secure city? I think, as well, it's doable, at least eliminating some of the more, immediate aspects of food security. As Lisa's presentation showed earlier, food security is not just one thing. It's not just having no food. There's many, many aspects to food insecurity. And one of the ways people can see that as well is like, try to look and search for the USDA survey for food security. And we'll realize that there are many, many aspects to it. The first is choice, right? The second is, access to food that is you consider healthy, right? So there's agency in that. It's not someone's dictation of what is healthy, right? It's a food that the individual considers as healthy. So it's really about concerted effort. And I think we saw shades of that in the pandemic, at the height of the pandemic, when people actually really in that acute moment work together. And if we can make that practice, I think that Pittsburgh could take the lead in this, just like Pittsburgh is taking the lead in community action.
Sorry about that. Thank you, Leah, very much. I'll get to you, Claudia. Just hold on. Lisa, do you have any thoughts on how people can address food insecurity?
Oh, definitely, Brooks. Thanks for asking that question. Yes, so we talk a lot about the food bank, about donate, volunteer, speak out. And so certainly I want to focus for a moment on the speaking out, on advocacy, and I've seen some questions about that on the chat. The child nutrition programs continue to be up for reauthorization. They have not been reauthorized. The federal government legislature continues to kick that can down and have down the road and continue to have continuing resolutions. But the Farm Bill is up for reauthorization starting this fall with the new federal fiscal year in October. And that is critically important. That's where SNAP, our food benefits, are in the past. There have been attempts to block grant or limit SNAP eligibility, and how it's right now. If you qualify, again, it is on an income basis. If you qualify, you're automatically eligible, but there have been attempts in the past to limit the amount of eligibility. So that's a critically important. It also helps support farmers and growers across the country and here in southwestern Pennsylvania. So getting more involved in advocacy, critically important. There are a number of federal food assistance programs. There's money in the state budget for food to food banks and other food programs, and also at the county and local level. So there's many opportunities to get involved, to advocate for all of those food programs.
Great, thanks so much, Lisa. Claudia, I know you have lots of ideas about how people can get involved and engaged, but let's keep it short. Give me about a 2-minute passionate plea on what the folks on this call can do to help address food insecurity.
I have one phrase, it's called food sovereignty. Food sovereignty. It ties everything that we all just said, from bringing it down to 5%. I think Lisa said, I think we talked about, getting numbers and data and getting people to download and using technology. Food sovereignty, the definition is a food system in which the people who produce, distribute, and consume food also control the mechanisms and policies of food production and distribution. We gotta chill out when we're given all the big contracts, and we're like, that has got to stop. We have to start to understand that the people are at the center. We have to understand that food sovereignty is the direction that we need to go into, where the people have a say in how they grow their food and receive food and have access to fresh produce and food. So for me, we're starting with the youth. We're starting with early childhood development. We're starting with, taking care of our seniors, and we're getting everybody in between. And, I know you said only 2 minutes, and, I'm usually shy, you know what I mean? But I want to say this. It will be very, very hard for us as Pittsburghers, who have all the philanthropy, who have all the programs. We have the most beautiful people in this city, the technology, the education. I would be remiss if I did not say, we will be very, very, it will be embarrassing for us not to become a food secure city. It will be embarrassing for us to have change in administrations, for us to have all these universities literally working on a million different reports and not able to really come together to use, public-private partnerships, to use the technology and the resources that we have in this beautiful region to not get this thing right. We got all the ingredients, pun intended, in the cupboard, and we still starving. It makes no sense to me. So my call to action right now, Brooks, and you my brother, and I love you, is for everyone, Black, white, for people in corporate education, for everyone to come together and start to work together. Break these silos. Let's create the first food secure city. Let's use policy. Let's use the people. Let's use the students. They have a voice. We all have a voice. And I'm tired of it. I'm not going to lie to you. And I think that this call is the beginning of something special when it comes to food. And it doesn't just go into food injustice. It goes into reproduction. It goes into, homelessness. It goes into all the injustices. Food is the one thing that we all have in common that we all have to do every single day. And so we can make sure that we get a lot of coming together and a lot of thoughts and solutions around food. So I think this is the beginning of something special. And, I know I get a little passionate about this, but we have all the tools. We have all the honey and the sugar and the flour. We need to make something special come out of this, all the ingredients that we actually have in this region. So that's just my way of thinking of it. And like I said, food sovereignty is the word that I think of. And so let's keep driving home that reasoning.
Well, thank you, Claudia. As always, very passionate, very clear and concise. And I know there's a lot of people asking for your email and information. So, and if you ever want to have an enjoyable evening, go down and have a cocktail with Claudia. I've done that once. We've done that once or twice together, Claudia.
A couple, once or twice.
Once or twice. We always have a good time. So there are a couple questions on here that we can just touch on real quick. There was a question about potential of food shortages. Lisa addressed that a little bit on, there has been some tractor trailer loads of food canceled. I don't foresee, and I certainly am not an expert in this, but I don't foresee widespread shortages, especially here in the United States. So there certainly is food available. It's just a lot of it is a logistical issue right now, getting it from point A to point B, with drivers, just like people trying to go on vacation this weekend, having people to fly planes, drive trucks, all that stuff is a difficult issue. I do want to touch a little bit on what Lisa talked about with advocacy and talking with your legislators. I do think and it's very underrated, but simply picking up a telephone and calling your legislator, telling them it's important to them, he or she. Your federal legislator, especially around the Farm Bill, that is a very contentious time in Congress. Every time it's up for bid or for renewing, not only around SNAP, but also about how they spend money on fruits and vegetables compared to grains and things. And so nothing can be done better than simply picking up the phone and calling. You may not talk to your legislator, but leaving them a message, and they are very good about getting messages and logging those because they want to hear from their constituents. So that certainly is very important. There was some questions about the idea of on who is impacted by food insecurity. I think we touched on that a lot. It kind of touches everybody. It really depends upon a change in your life. Could be longstanding issues. There's lots of different things around that. Am I missing anything here on this that anyone, Wendy, is there anything that I should be addressing before I hand it off to Alyssa?
No, Brooks, great engagement in the chat and great job moderating the conversation, but I think we're ready at this point to turn it over to Alyssa.
Great. Well, thank you, Claudia and Lisa and Leah and Dr. Curry. It was a wonderful chat and great hearing from all of you. Thank you.
Thank you so much for having me. My link tree is in the chat as well.
Great. Thank you so much, Brooks. This was an incredible conversation. There's a lot of calls to action, really great engagement, talking about connection. I know I'm here for it. So let's keep this going. Have a food secure city, county, region. That would be the dream. So thank you to our experts, Chef Claudia Pierre, Dr. Sandra Curry, Leah Lizarrando, and Lisa Scales. You've given us so much to think about here. Great discussion. I think it's just amazing that we can come together like this, in this way. Let's continue this work together. You can do many things from the audience. I know there's been discussion about ways to get involved, how to get more materials. There are things you can do right now. You can donate to your local food banks, the Greater Pittsburgh Food Bank, the Westmoreland Food Bank, your local food pantry. You can invest. United Way has a strategy called the Meeting Basic Needs Investment Strategy, where we'll be focusing on meeting food insecurity, housing, and others that we talked about, the entwining of all of these issues. You can volunteer with 412 Food Rescue, again, with the Greater Pittsburgh Food Bank, the Westmoreland Food Bank, other local pantries that might be in your neighborhood or where you work. Join. There's so many hot button issues going on right now. Hunger sometimes gets pushed aside, but as we've discovered through this conversation, it's really vital and key to our community. You can use your voice by joining the Campaign to End Hunger, which provides policy updates and advocacy opportunities, great information that they send out. So on behalf of United Way of Southwestern Pennsylvania, I want to thank you so much for taking the time to be with us today, investing in this topic. This entire session has been recorded. It will be available on our YouTube channel, so you can go back and rewatch it or send it to people that you think would be interested in this topic. I also want to say again to thanks so much to Eden Hall Foundation for your continued support, allowing us to bring this great group of people together, a fantastic audience, to host forums like this. It's continued to be United Way's commitment to engage our community, to talk about the issues, not just talk about them, but let's work on solving them and solve them. So thank you again, Brooks, for bringing us together, and for each of our panelists, thanks for the work that everyone is doing in this very important space. The question before us will return later in fall with another timely topic. In the meantime, let's continue really delving into this as well. Thanks so much for joining us. Have a great day, everyone. Take care. Bye-bye.